My name is Dr. Daniel Fox, licensed psychologist in the state of Texas, expert in the area of personality disorders. And in this video, we're going to talk about abandonment, particularly the fear and pain that is associated with abandonment. Now, if you've watched some of my other videos, you've seen that I talk about what's called core content and surface content. Abandonment tends to be a core content issue for a lot of my clients. And I think a lot of individuals that are along the BPD spectrum, those that have the full disorder of BPD, as well as those that have BPD traits. So they have enough traits, but they don't quite qualify in the mental health community for the full disorder. So the fear and pain of abandonment is something that a lot of my clients are struggling with on a regular basis. And that is that a lot of times they'll meet someone and they'll be very excited about that person, and they'll be like, this person could be my soulmate, this person is this wonderful human being, and they seem to understand me, and we're having great times together, and we're doing great things, and it's very exciting, and there's this sense of idealization. Now, that idealization is good because you're hopeful and you're excited, but also underneath, and what's driving it, is that fear and pain that's associated with abandonment. And that issue of abandonment can sometimes drive that devaluation. What happens here is that then that fear starts to sort of seep into your head. It starts to say, well, he or she doesn't really care about you. He or she is using you. He or she is going to cheat on you. He or she is going to leave you. And when they leave you, you will be completely and all alone. And that loss will equal you becoming invisible and irrelevant to the rest of the world. Now, some folks who watch my videos, they maybe have family members or loved ones that are along the borderline spectrum or have traits of BPD. And I think that they don't quite get it. They don't like, well, I'm not going anywhere. Why would they feel that way? Why would they think that? I said that, well, a lot of times this comes from some what are called early abandonment experiences. And sometimes it can be that early on, they were left with someone and that person abused them. They were left alone for periods of time. Their needs were neglected. And I'm not saying that everything is related to the abandonment experiences. What I'm saying is that they've maybe had those experiences, those traumatic abandonment experiences. And then as they've developed and gotten older, they've become more central, internal, more core to how they operate and see the world. And then as they're older and they're going through their life and they're living their life and they're meeting new people and they're having intimate experiences and they're having friendship experiences and work experiences and all these other things, this issue of abandonment is still there because it's core. And in the therapeutic process, what happens here is that I notice that my clients will attach to me. They'll start to really enjoy the therapeutic process. Then you'll get a resurgence of maladaptive patterns. And I've done a video on that as well. Put the link here. And that resurgence of maladaptive patterns, which is sometimes driven by the fear of abandonment, which is core content, causes them to then be resistant in treatment, sometimes stop showing to treatment, sometimes it can become very complicated. And this is where a lot of mental health providers then are like, see, well, all borderlines are like that. And that's not true. All individuals with borderline personality disorder are not like that. They don't all behave that way in treatment. And I've had other videos that have talked about that as well. But the issue of abandonment, I think, is so central. So how do you deal with it? So when folks are working with me, we talk about core content. I have something that is on my desk that is their core content that's written out for them to see every time we meet so that they're aware, and that as they're telling me about their week and their stories and their interactions, and we go back to that core content, and if abandonment is one of those core contents, a lot of those stories and a lot of those experiences and interactions that they have fit as being driven by the fear and pain of abandonment. And when we start to talk about it, we explore it, and they're like, oh, okay, so I get it. So how do you deal with it? You deal with it by first building insight. We know that insight is critical to change. I've talked about that through many, many of my videos. Insight is critical to change. How do you get insight? You have to be aware. Do you have that internal fear that people are going to leave you? That loss of those people and they're usually idealized at this point, that the loss of those people equals you being destitute, alone, and perhaps invisible, or some of my clients have said, or I'll completely disappear. And that's very, very frightening. I mean, think about that. Even if you're not along the BPD spectrum, imagine that you had the thought that if this occurred and you don't have any power because it's external, because you believe that this other person, that if they disappear, and we can't control other people, so let's say that person disappears, and maybe to no fault of their own, right? Sometimes they pass away, or sometimes other issues occur. So when that person goes away, then you become invisible and disappear. It's very scary. It's very scary, and we process that, and there's a lot of emotions with that. Sometimes there's a lot of crying, and sometimes there's issues of depression, there's issues of anxiety, there's issues of rage, there's issues of anger. And sometimes what we do is we can tie that back to those early abandonment experiences, but the insight is critical. Building insight to that, recognizing what that is the first step. Second step is you don't need that other person. As wonderful and great as they are, remember, even if they're idealized, maybe they deserve it. They're super great, they're really cool, they're really fun. Everybody has faults, everybody's a little wacky, everybody's a little weird. That's okay. But no one's perfect. You don't need someone else to complete you, to make everything okay. And that's the insight is critical. The tough part is the acceptance of yourself, that you don't need anyone else. And I think that's where a lot of growth comes from. That's where you have to recognize who is in your interpersonal circle. And are these people supportive of you? Do they use your fear of abandonment against you? Do they not understand? Are they not patient? And that's okay. People are allowed to make their own choices. But I think we have to recognize that it's okay not to have other people in our life, that sometimes we can be okay. And I think telling yourself that, right? Building the insight, telling yourself that you don't need other people to exist, to feel like you're relevant, to feel like that you're central to your own life, and that people will gravitate to the gifts you have, to the things you have. And if that sounds cheesy, it's not cheesy, because a lot of my clients, a lot of the folks that I know have great gifts, are very interesting, are very fascinating, and not because of the dark side of them, not because of the BPD side of them, but because of all those other facets. They're great artists, they're great thinkers, they're great writers, they're articulate, they're interesting, they're fun, all these other components. So I think that insight is first component, and you becoming okay, not needing those other people, is the second part of that. And building on these two components can help lessen the fear and pain of abandonment. And I hope that this is helpful for you. Please leave comments about your process, or how you manage that core content issue of abandonment. I try to read the comments. This video was a suggestion. Someone wrote me an email, gave me a suggestion. I thought this is a great idea. So here we are. And I hope you enjoyed the video, and thank you very much, and take care. Bye-bye.